As a treatment option that we can use, we have passive physiologicals and passive accessories. So I'm going to be showing you primarily four techniques in using passive physiologicals using different grades. So through our evaluation, we determined that this patient is highly irritable, very pain dominant, but we want to try to do something that we can help alleviate her pain. So number one, we get them into a comfortable position and find out what that might be and getting them in side lying. And you want them pain side up. That's what you're going to be addressing. If that's too uncomfortable and they can't sit, then go pain side down. But typically the technique is performed with their pain side up. So with a grade 1, their forearm is just going to be right here. I'm going to have my hand on her pelvis, and so this is a grade 1. So it's a very gentle movement, oscillating her pelvis and just doing a small movement. I think Maitland book says it's as if you're bending a fly's leg. So we're talking very small, very highly irritable patient. That's a grade 1. With a grade 2, I'm going to put her forearm onto her rib cage. And here it's going to be more of a larger amplitude rotation. And with this, what I'd like to see is her shoulder going opposite in direction of her pelvis. So just getting a nice rhythmical, obviously determining the patient's signs and symptoms and everything else. So that's a grade 2. A grade 3, let me have you facing me just to show the setup. It's very similar to when we're setting up, when we're assessing PIVMs. Here, this is a general rotation, so I'm not being very specific to the specific level. I'm just going to be doing general rotations to her lumbar spine. So I'm just going to palpate in her lumbar area. Let's say I determined it was more lower that I wanted to focus on, so I'll just get her into a neutral position. Have her straighten out your bottom leg. And keep her there. And then I'm going to drop her top leg over her bottom leg. Let me have you lift your head up and relax. And here I'm going to add, relax for me. She's trying to help me like a typical patient would. I'm going to put flexion and rotation. Putting her arm here. And so with this, she looks very balanced and even. She doesn't feel like she's going to fall off. That's one of the components if in turn trying to determine, do I have her set up well? So she's nice and balanced. Then I'm going to come around. Now I'll have my hand here so she doesn't feel like she's going to fall off. And I'm going to do a grade 3. So with a grade 3, I'm going to take her to her end, come off. It's a 50% of the range. And I'm going to hold her shoulder just a little bit and doing a grade 3 movement. Now to set up for a grade 4, I'll have her drop her top leg down, stabilize. I can either stabilize her shoulder or stabilize her rib cage, and then take her to her end range, and it's a small amplitude rotation. And then after the setup, I'll have her come out and reassess my asterisk signs. Another option of treating the lumbar spine is doing passive accessory movements. And I'm going to show you 4 different grades, grades 1s, 2s, 3s, and 4s, where we're going to be using central PAs, unilateral PAs, and transverse PAs. So if I've gone through my assessment and determined, let's say, that it's L5S1 seems to be the structure involved, I'm going to use my thumb to do a grade 1. So I'm going to feel for R1, come off of it, and then do a very gentle oscillation, grade 1, not going into R1 at all, or P1 for that matter, pain. If I do a grade 2 central PA, I'm going to go to R1, come off of it, and with a grade 2, I am just close to getting to R1, but not quite at R1. And it's going to be a larger amplitude. Grades 3s and 4s can be done with your thumbs. I prefer to use more of my pisiform area because my thumbs are getting tired. So I'm going to find L5. I've gone through my assessment, found where R1 is. Going to go all the way down to R2. Doing okay. Always communicating with the patient, determining where their symptoms are, any increase or decrease in their symptoms. So with central PA grade 3, I'm going to go a large amplitude. And a grade 4, I'm going to go to end range, and it's going to be more of a small amplitude. You doing okay? Once again, talking to the patient. So those are central PAs. With unilaterals, you can use either the facet joint, which is quite deep, or come off and use the transverse process of the segment that's involved. Either or. Usually, which one you would pick would be what actually reproduces the patient's pain. If that is your goal, is to reproduce their pain and mobilize it and seeing if that makes a change. So palpating the spinous process, coming off the spinous process, doing the central PA. So here I would bring the table down so I can be a little further over the patient. My arms are nice and relaxed. I'm using my body as I'm doing the MOB. So I'm feeling for R1, kind of assessing where P1, talking with the patient, where P1 comes in, and determining, does it pass R1? Is it at R1 or is it before R1? And that will help me guide what grade of movement I'm going to choose with this patient. So the technique is going down, feeling for R1, come off, and a grade 1 is just a very small amplitude, very pain-dominant patient. Just trying to get a little bit of movement, get a little neurophysiological effect to their pain. The next is going to a grade 2, going to R1, and then doing a larger amplitude. Grade 3, going to R1, go to R2, going to be at 50%, and doing a larger amplitude. You okay? And then a grade 4 at or near R1, and it's a small amplitude. So my fingers should be nice and relaxed. I'm using my body, not using my hands. So I shouldn't be doing this. It should be coming more from top of my body. With transverse PAs, usually this technique works more in the upper part of the lumbar spine and thoracic spine. A little harder to do in the lumbar spine, especially at L5. L5 tends to be quite deep. I'm going to raise the plinth up. So I'm going to pick L1. Here I'm going to come lateral to the spinous process. Usually done, first tried, if the patient, let's say, had pain on their right side, I'm going to go towards the patient's pain. If I didn't have any improvement, then I'd go to the other side. So again, with a grade 1, feeling for R1. So really coming in lateral to that spinous process, kind of getting to soft tissue and bringing my thumbs under, getting into a stride stance, and feeling kind of where R1 is and R2 is. And with a grade 1, it's a very small amplitude. Grade 2, kind of go to R1, pass it, and a larger amplitude. grade 3. Here we're going R1 to R2, going 50% of the range. And here's a larger amplitude. Again, paying attention to the patient's symptoms, any increase, decrease, what's happening. And then grade 4 is at the end range, small amplitude.